What is the dry eye disease?
So dry eye disease, or DED, was redefined in 2017 at the Tear Film and Ocular Surface Society International Dry Eye Workshop 2, TFOS, what we call DOOS 2. And it was a very complicated definition, but basically a multifactorial disease of the ocular surface, which is characterized by a loss of homeostasis of the tear film and accompanied by ocular symptoms in which you have also tear instability, tear film instability, hyperosmolarity, ocular surface inflammation and damage, and also neurosensory abnormalities, which can play etiologic roles. Although this is a complicated definition, really in your day-to-day practice, you just have to listen to your patient's symptoms, looking for some classic symptoms of dry eye disease, such as burning, irritation, sandy feeling, blurry, fluctuating vision, especially with activities on screens, TVs, computers. Patients also complain a lot of reflex tearing. Those are all sort of signs that, symptoms that we hear from patients.
What are the most common presentation of the dry eye disease?
So I mentioned a few just now, but basically burning, redness, irritation, feeling something in your eye, foreign body sensation, sandy feeling, tired eyes, itchiness. You can also get some photophobia or light sensitivity. You can have blurry vision with computer work or any kind of screen work. Anytime you're staring at something, you blink less, so the blink rate goes down and patients can have blurry vision. Reflex tearing, fluctuation in the vision, worsening of symptoms at the end of the day, especially if you don't have enough tear production. There's also the evaporative dry eye disease, which is sometimes worse in the morning, and you have like sticky lids in the morning. Contact lens intolerance, all those are things that you hear from patients very frequently.
How serious is dry eye disease?
So dry eye disease, if left untreated, the nature of the disease actually worsens. So patients will get worse with time, and when we grade the disease, it actually does worsen with time. It's been shown in studies. And the patients risk having a decreased quality of life because of the blurry fluctuating vision, because of the discomfort. Also, you can have a higher risk of corneal ulcers, which can be very detrimental to the vision if you get a scar, or you can sometimes have more serious infections that are hard to get rid of. So it can be vision threatening for sure.
Who is at risk of dry eye disease?
So there's a long list of risk factors. The main ones I would say are older age and female. So women that are postmenopausal is a classic dry eye patient. Environmental factors. So if you live in a very dry environment like Texas, you'd have more dry eyes. If you're in a humid environment, it would be certainly more comfortable for dry eye patients. Other things are being on screens or devices for a long time. Like we tend to blink a lot less when we're looking at a screen. So the blink rate goes down and people evaporate their tears more and they feel the dryness a lot more. So screen time is another big one. Other things that are noteworthy would be contact lens wearers, hormonal changes, as I mentioned, postmenopause, but any hormonal changes, hormone therapy, Asian descent, smokers. Those are some of the main ones I would say.
Which condition or medication predispose a patient to dry eye disease?
So there's a whole list of them. If we start first with autoimmune diseases, which is a very common one, so thyroid disease, diabetes, rheumatoid arthritis, Sjogren's, even GVHD, so graft versus host disease, which is more rare, but would be in that category. Rosacea, psychiatric disorders, certain medications like antidepressants or antihistamines. And lastly, ocular conditions, which can be things like glaucoma, meibomian gland dysfunction, pterygiums, anything irregular on the surface. Any recent ocular surgery, like LASIK, for example, in young patients, or any kind of surgery, really. And lastly, exposure. So if your eyes don't close properly, or you have any lid disorders, like a seventh nerve palsy or blepharoplasty, where your eyes don't close properly, you can have a faster evaporation, and that can cause some exacerbations as well.